Hi, I'm Dr. Rajani. Thanks for joining me today. I'm talking about my skincare routine. Definitely not comfortable talking about myself. I'm always talking about everyone else and we're looking at other faces, but everyone said, what are you doing? What do you put on your skin? So I'm going to do it. I'm going to tell you, I certainly don't care. I don't mind sharing everything with you. What do I think about my skin? It's okay. I maintain it. I like to have it as best as I can. I want to reduce fine lines and wrinkles. I want to protect it and maintain. If I can protect and maintain, I'm pretty happy. I do injections, I do devices once in a while, and I do skincare routines. So I'll take you through what I do and kind of how often. My goal for skincare is maintenance, maintain, just look the best as it can be in terms of angles, lines, and folds. There's 7 things I'm unhappy with, of course. You can take the best looking person in the world and they're unhappy with 17 things about themselves. And you just take average people that live everyday life and are working and do things. They want to maintain, they want to look good, they might want to optimize some areas. And then some people don't care at all, or they grow a beard, or they do different things. So I'll take you through kind of what I've done over the last few years, and also skincare, and I'm also excited to tell you about a new skincare product. Okay, so off the top of my head, I'm just going to tell you, I haven't written anything down or thought about it, but I'll just take you through skincare routine. We're going to start with that first, move into the injections, and then the plasma procedures. If you like the videos, click like, subscribe. You're telling me what you want to hear. I know it. You're telling me in the comments because my list on my phone is like a couple pages long. And I love when you comment and educate me as well. Skincare routine. Forever, meaning like 10 years, I've always used a fresh vitamin C, always had that in my skincare line, and I believe in a fresh L-ascorbic acid. So I have that with hyaluronic acid. It's evolved from a pure serum to more of a serum cream as a carrier. I think that's worked better for us in our line. I use a Retin A. I want all my patients on Retin A's, and it works very well with Plasma Sculpt, which is #1 thing I do in Sculptra. So a retinoic acid, and for me and my line, my patients, it's only available to my patients. I use 0.1%. We can always decrease down from there or decrease frequency. So retinoic acid, and it's a combination product. I love the ingredients that are in it, and there's a little bit of a steroid, and then a separate one that I would use that for me, a male skin with a bit of oil, for instance. I can use that 3-4 days and 5 days in a row, no problem. I use it at night, sometimes in the morning if I'm not going to be exposed to the sun. The key there is, if I'm feeling tight or inflamed, you got to pull back. That's when the sun is going to damage the Retin A. That's why when sun reacts with the Retin A is from fragile skin. Just like if you've had a peel, the post care is oh so important. Your practitioner can give you the best peel in the world, but if you don't do the post care, you're going to ruin your skin and get post-inflammatory hyperpigmentation, all that goes with it. So that's how I view Retin A's. I use them for years. When a patient walks in and has done nothing, and by the way, people on here tell me I'm 70, I look 30, I've never done anything. I'd have to see it, and I want that formula. I don't believe it. I don't believe it exists. But there are people that are 50 and 60 and look 10 years younger, partly because of bone, partly because of genetics, sleep, eating, all those things, or it might be just genetics. That trumps just about everything. But one common denominator almost always is from a foreign country. You used to be able to get cheap Retin A's, retinoics, and that's what I do, doc, all the time. That would be a common theme. So retinoics, doesn't matter to me what study you bring me or what new data you show me. Seeing thousands and thousands of patients, we just know it to be true. There are pitfalls, no question. There are pitfalls to retinoics. But used properly, yes, it's a common denominator to maintain youth. I know you guys all talk in all the forums about thinning of the skin and all these things, but it's what you do post-care, how much you use more isn't better. So retinoic. Hydroquinone, in my line I have at 8% with a steroid. It's aggressive, but I can walk my patients through it, and it helps lighten the skin. I know people like skin bleaching products and all those types of things, but in general, sometimes just to reduce brown spots, to reduce the melanin production, a kojic there's Kojic, there's a steroid, and there's 8% hydroquinone. That works for me, my patients, and it works for the treatments I do with them. So the final product, and I think it's what you guys have been seeing that you notice is, oh, there's a difference in your skin. I see it's more glowing. Those of you who have commented that, I mean, I think I've seen that over the months, and it's a product I developed over the last 6 to 12 months, and this is what it looks like. So it's a vegan hyaluronic acid at 2% with a fresh vitamin C and kojic acid. And I think because of those ingredients, and I tried many different ingredients till I came on this one, but I think what you're seeing and what I'm seeing is you get a brightening, and it's from the kojic and the vitamin C. And of course, the carriers are important to make those work, meaning a hyaluronic acid serum is a nice carrier for a product like that. And of course, my whole video of showing how it draws the water and what it does, and it's what we inject in faces. You can have hyaluronic acid non-cross-linked as kind of skin boosters. You can have skin boosters like Vital and Vital Light that are cross-linked. And then of course the fillers that stay to 1 to 5 years plus, those are usually bacterial cross-linked hyaluronic acid. These products are not cross-linked hyaluronic acid. In terms of procedures, my favorites are VFR, that's a Viora fractional radiofrequency. So it's not the microneedling radiofrequency that would be more aggressive for deep rhytids or deep wrinkles. My patients typically shouldn't get to that point. You do not want to have wrinkles. At that point, you're reversing, okay? It does work well for reversing folds, but I also have PDO threads and Sculptor for that should I need to. So VFR is radio frequency, which is the electrical energy. It does go deep, but there's no pins. It's not injected. There's a way to do it, and we did the trials in our practice where you can use it on the surface without the pins and get the same results deeper. It helps with browns, it gives glow, it helps with the texture of the skin, and then following that with a plasma glow, a couple of those a year, and of course plasma eyes, which you saw here. I did the video. Must be a month and a half. I'm probably 6 weeks out from that. I'm going to do another, and maybe I'll tape that one so you can see. So on the injectable front, that would be the plasma eyes. Couple chemical peels a year. When you have the downtime, you know you're not going to get sun. I do a couple VI peels, love those. And then on the injectable front, plasma sculpt. So you saw the eyes portion of that on the video. The temple is important when you don't carry a lot of weight. End of the summer, doing more cardio activities, lower weight. Come the winter, different sports, and a lot. This is just real world stuff. It's many of our patients the same. Some are in eating more. Of course, in these times, a lot of people aren't out mingling. They're not getting out there eating and drinking more. We know that from the food stocks are doing very well. People are eating more. But different sports in different seasons, a lot of people, I'm going to gain weight. I'm going to gain 5 to 10 pounds going in to hockey season. You want to have a little more weight on you. Whereas if you're biking, you're mountain biking, you're leaning out. Temporal hollowing's an issue. So sometimes leaning out, sculptor in the temple, probably every 2 years, 18 months. And then of course plasma sculpt, as you see. The video I did most recently on that would be look 10 years younger. And that's blanketing the whole face, different concentrations, different depths. But it's very dependent on what you're seeing. If you have a lot of loose skin, you're changing the concentration. If you're down around muscles where you can get nodules and with the products, you're adding more PRF. If patients want a more natural, subtle look, maybe you want a lighter concentration. We're never putting biostimulators under the eye, in the lip. There we're using different concentrations of PRF and Sculptor because pure biostimulator there would be a disaster. Same around muscle, concentric muscles, being very careful. The wish list, what's on the wish list? Just like everyone, you have a wish list. You might not get to it. It might be a year before you do it. Most importantly is living life, doing all the things. You can block time away. Many people live a different type of life. If they're going to the indoor gym, if they don't get out, if they're not in the ocean, if they're not getting sun, if they're not playing sports, they don't have to worry about bacteria getting into all their procedures. You have more options to take care of your skin and do more things. For many of us, it's working procedures around making a decision. If I'm going to have larger openings in my face, if I'm going to have resurfacing done, you don't want to get sun exposure. The post-care is as important as the procedure itself. And people forget about that, but it leads to problems. Every practitioner is going to have their routines of things they like to do, combinations that work for their demographic of patient. There's not one right one. I know what works for me and the patients that see me. Obviously, their friends are going to be the best referrals that come in to see me, and they have the same mindset of their friends, and that builds the type of practice that I have. There are many different types of practices. All can be great. It's art and science put together. Knowledge is key. Stay tuned here to keep your skin and body beautiful, healthy, and vibrant.